Thank you for joining us today for our CAPS monthly meeting. I'm Jenny Ebast, and I'm going to be introducing Dr. Peckham today. She will be our speaker. I have a few announcements first. Our annual gala will be a virtual gala this year on November 6th from 6 to 7:30 p.m. There will be a raffle, an auction, there will be live music, and a program lineup. We ask that you please RSVP so that we know how many to expect. Sponsorships and donations for the auction are requested, so please call the CAPS office if you have something you would like to donate. 512-371-3373. We also have counseling available and support groups for those who would benefit from these. Again, call the CAPS office at 512-371-3373. And now for our speaker. We are so excited to have Dr. Peckham today. She's part of Central Texas Neurology Associates, a specialist in movement disorders. Dr. Peckham is board certified and completed specialized fellowship training in movement disorders. You can read more about her on the CAPS website. Thank you for being our speaker today, Dr. Peckham.
Hi everyone, I'm Dr. Peckham with Neurology. My office is in Round Rock, Texas, and I am a movement disorder specialist. I'm going to be doing a lecture today, so I'm going to go ahead and share my screen for you. Fingers crossed this works. All right. Okay, so the topic today is going to be Parkinson's and COVID-19. And just a little bit of background information on this topic. Prior to each lecture, I generally ask if there's something that the CAPS members would like to hear about. And COVID and Parkinson's came up as a topic based on the Michael J. Fox Foundation webinar in July 2020. And I'm just going to start with a few disclosures. We do have a clinical trial center at Central Texas Neurology. And I've participated in multiple clinical trials with the following companies listed. I've also served on several advisory boards for AbbVie, Impacts, and Revance Pharmaceuticals. So what I want to cover today initially is to review some of the highlights from the Michael J. Fox Foundation study that was done. I'm next going to go on to some observations that I've had with COVID just in my personal neurology clinic. Third thing that we'll talk about is what can you do? And last, new treatments that are coming up for 2020. So COVID-19 and Parkinson's. There's really this the only study here is the survey that was done through the Michael J. Fox Foundation regarding Parkinson's and the pandemic. And it was a review of about 7,209 respondents over a 31-day period, and this was April through May of 2020. And what they found is that the COVID experience was not a lot different for patients with Parkinson's versus people without Parkinson's. So both groups exhibited similar symptoms, similar levels of hospitalizations, and similar ICU stays. And specific things that they looked at comparing both groups, the Parkinson's and the non-Parkinson's group, were percentage of patients that had pneumonia, percentage that needed supplemental oxygen, hospitalization, ICU care, and ventilator support. And that was the same whether you had Parkinson's or whether you did not have Parkinson's. They also looked at some subgroups. They looked at Parkinson's patients that had been infected with COVID. And what they noted is that their motor symptoms did worsen. They did have more stiffness, more tremor, more problems walking, and more balance issues. They also noted that what we call the non-motor symptoms worsened as well. Sleep changes, mood was worse, cognitive ability, and autonomic problems. And an example of an autonomic problem would be difficulty regulating blood pressure upon standing, sometimes urinary frequency or urgency, constipation. That's all your autonomic nervous system. So those things were worse also if you had Parkinson's and if you were infected with COVID. In patients not infected with COVID, they asked several questions just to ask about general disruptions in their life. And 62% reported healthcare alterations. 21% reported that their exercise was canceled. I'm actually surprised that that number is so low, because I would say in the Austin area at this point, at some point, we've had up to 100% canceled and moving to virtual. Social activities were canceled in 57%. Essential daily activity was disrupted 35%. Again, I'm kind of surprised that's not higher. And then 18% of patients experienced new motor symptoms, while 55% reported worsening motor symptoms. There was some disparity in access, both in lower income individuals, where they had difficulty obtaining medication, and also lower income were less likely to be able to use alternative ways to exercise or access care, such as having access to telemedicine. Non-white participants as well had more difficulty obtaining medication. So as we go through here, I'm going to see if this works, but I've got a link to the webinar. And I'm going to show you on the next slide how to get to it, because you can actually sign up to watch the whole thing by yourself on your own time. It's about an hour, and they do have a question and answer session as well, and they can give you some more information on this. I just wanted to hit some of the high points. So in order to get to the webinar, and again, hopefully this will work since I'm screen sharing, we're going to go to the michaeljfox.org website, and on that, you're going to want to look through Understanding Parkinson's webinars. The date was July 16th, and then that will pull up. So let me see if I can get this to work. Yep. So this is the Michael J. Fox website here. I'm going to minimize myself here if I can. There we go. Okay, so under Understanding Parkinson's, okay, I'm already on their email list. If you go under Understanding Parkinson's, this is where my little hand is there. Under Webinars, you're going to click on Webinar. And then you're going to say that you are okay with using cookies. And if you scroll down, the webinars are on the third Thursday of every month at noon Eastern time. So that's 11 a.m. our time. I'm just going to scroll down here. And there's an upcoming one on the same day of the CAPS lecture, September 17th. Here. And then here it is. So Pandemic and Parkinson's. So if you'd like to see the whole thing, you hit Learn More. And then you are able, even though the webinar is passed, you can always watch this at any time. So you just sign up, you register for it, they're free. And you can watch it again on your own time. So if you'd like more information, that is something that you're welcome to do on your own. Okay. The other thing that is still open, and the Michael J. Fox Foundation, really, this is the only validated information that we have as far as what patients are truly experiencing. So the survey is ongoing, and it's on foxinsight.org. Again, I was going to show you how to do that as well. If you have any interest in being part of the survey, again, this only carried through May. So I'd imagine in another few months, once they get 3 to 6 months more of data, we're going to have a lot more information, which will be able to help us to give patients better answers when they ask about Parkinson's with COVID. So again, I'm going to go just to Fox Insight. If you go to foxinsight.org or michaeljfox.org, again, you have to agree to cookies. And this goes through very well here as far as learning how to get started. you have multiple options of what to do if you do want to participate. There are multiple online surveys, so this is one of them. So if you have an interest in participating, if you read on this, learn how to get started. I went through this, it's a 6-minute video. I'm not going to go through the whole thing, but they really walk you through what information they take from you, what they do with that information, how to sign up, how to register, that type of thing. So again, if you have an interest, you're welcome to do that, again, on your own time. So I wanted to then blend into what I get in clinic, because we certainly, you know, as neurologists and movement disorder specialists, get a lot of questions from patients on what does this mean for them. So the top question that I do get is, am I at higher risk of contracting COVID because I have Parkinson's? And the short answer to this question is no. Right now, and again, we're basing this off the Michael J. Fox survey, as well as other information that's coming in from other sources. But the short answer is no. And I'll qualify that with a but. You are at higher risk for both contracting and having complications, including death from COVID, with the following: older age, and really anybody above 50. I'll show some graphs here shortly. Certain health conditions do put you at a higher risk. Oh, sorry, I didn't mean to do that. Just trying to get this bottom, trying to get this hidden here. There we go. So older age, certain health conditions such as cancer, chronic kidney disease, heart disease, any immunocompromised states, obesity, or sickle cell disease. So that does put you at higher risk. And I wanted to show you, this is mortality rate by age, and these are CDC statistics. I'm recording this presentation on September 7th, so this is about 10 days before you all will actually be viewing it. So these get updated weekly, so there will be more information, but I wanted to connect, let's see, let me go back here. I wanted to connect to the CDC link here and show you a few things. So there's really a lot of good information. I had not been on this website in some time, but I thought they do have some nice graphs. And this is really males and females COVID deaths. And really the big take home from this is the orange dot up here at the top is 85 years and older. And the dark blue one at the bottom is, the light blue one is 0 to 24 years. The kind of purplish or dark blue one is 25 to 34. So you can see there's really an exponential increase. If you look at up to 24 years, it's almost flat. And then by the time you get to 85 years and older, there's a really large peak. And it does increase by decade. You can also, this graph is interactive. You can look at females, which I thought this was kind of interesting. Females, there's a much higher proportion, again, right now, what we know, and this is United States data through the end of August versus male. Actually had a higher proportion of males who were 75 to 84 years versus 85. So that's kind of interesting. They have COVID-19 deaths and total deaths. So there's a lot of interactive graphs and things in here. And again, this is just the cdc.gov, and I went through the COVID statistics, again, if you're interested on your own. So this is something interesting and new that I just saw yesterday in the news about vitamin D deficiency in COVID. I had not seen this published before, but a couple weeks ago, I had one of my kids go to their well child checkup with her pediatrician, and she had recommended putting all of her kids on vitamin D because she said there is some evidence with pediatrics that kids who are vitamin D deficient are at higher risk for COVID. So this is just a news article through Medscape. This is available to everybody. It's on medscape.com, and this is the specific number of the article, 936928. And basically what they showed, and again, I'm not going to go into a lot of details with this, but just that patients or people who had untreated vitamin D deficiency were nearly twice as likely to test positive from COVID to with COVID-19 relative to peers with adequate vitamin D supplementation. So the other question I get from patients is this really real? Do I need to wear, I'm going to move myself down here so I'm out of the way. Maybe bottom corner would be better. So is this really real? Do I need to wear a mask? Do you really know anyone who's had it? And the answer is yes, yes, and yes. So yes, I think it's real. Yes, you need to wear a mask and take precautions. And yes, unfortunately, I've had multiple patients who've had it and recovered and done well. Also, unfortunately, I've had multiple patients who have passed of COVID. So what can you do? Some of this has been talked about nonstop since March, but obviously wear a mask, wash your hands, limit social interactions. I would say in addition to that, get your flu shot. Nobody really knows what's going to happen during cold and flu season. Initially, I think when COVID was ramping up, we all thought that the summer would be a reprieve, and unfortunately it was a peak here in Austin. So hopefully they're wrong and that the flu and COVID are going to be a bad combination, but I have a feeling, unfortunately, that they're right. And so anything you can do to protect yourself against more severe complications, being able to stay home is really important. So please get your flu shot. I always give advice that I follow myself. I got mine several weeks ago. I've got all of my kids went last Friday, fighting it tooth and nail, but all of them got vaccinated as well for the flu. The last thing I would say is starting on vitamin D. And if you're not sure what your levels are, a safe amount to take is anywhere between 1,000 and 2,000 IU or international units per day. If you are vitamin D deficient, and the only way really to test for that is through a blood test. If you are vitamin D deficient, usually they recommend 50,000 IUs weekly. But again, that's only if you get a blood test. You can get vitamin D toxic, so I would not take really high levels unless you know that your vitamin D level is low. So general guidelines for maintenance at a safe level would be 1,000 to 2,000 IUs every day. So next, I'm just going to go on to clinical experience with COVID in my clinic. I'll move myself around in the screen here. Let me see if I can minimize me. There we go. Still there. All right. I'll move it around once we get to it. So these are quotes from my patients in my practice. I feel like a prisoner in my home and my husband is the warden. I thought that was a pretty funny one. Another one, and this has come from several patients. I just retired. My whole year was ruined by COVID. We had to cancel all of our trips, all these things we were looking forward to. I haven't seen my grandkids in months. I used to see them every day. Another patient, I need help. My spouse has a full-time job and needs memory care. I plan to put him in a facility, but now I feel guilty at the thought of it. What if he catches COVID and dies? My husband fell and hit his head. I don't want to take him to the ER. What do I do? We've had multiple calls like this where a patient thinks they're having a stroke. Somebody falls and hits their head. Any normal thing that you wouldn't think twice about going to the emergency room. Suddenly now we're all having to make kind of life and death decisions over the phone and trying to guide people in the best way possible. I'm just tired of Zoom. I want to see real people. My kids won't let me do anything. I hear this one probably 5 times a day. So I'm sure many of you feel the same way. This is the first time out of my facility since March. When I go back, I have to self-quarantine for 2 weeks. So this was a patient who came in to see me to get botulinum and DBS programming and botulinum toxin DBS programming, and she had to go self-quarantine for 2 weeks when she went back. I was exercising every day prior to COVID. Now I haven't worked out in 4 months. I hear this a lot, and I know a lot of people are frustrated, very down on themselves for how well they were doing before and how difficult it's been with all the changes. We can't leave our room, even to go check the mail. All of our food's brought into us and taken away. This is the only human interaction that we have. So what do I hear as part of these conversations? Well, a lot of emotions: fear, loneliness, despair, loss of control, frustration, sadness, isolation, and a loss of independence. And what am I seeing? Well, what I'm seeing, what I'm hearing described by patients are that their motor symptoms are indeed worse. They're slowing down, they have more tremors, they have more falls. They're noticing more of the non-motor symptoms: increased levels of depression, anxiety, apathy, sleep disruption, worsening memory, more behavioral change, such as more hallucinations or delusions. This is more common, obviously, in a patient that has dementia, and much higher levels of caregiver stress. So what can you do? Well, I think one of the main things I recommend is putting yourself on a schedule. For all of us, when COVID happened, many of the things that we take for granted as part of our everyday lives were gone. And I think that there are many reasons, which I'll go into, to try and keep your life as scheduled and as organized as possible, even if you're not doing the same events as you were before. So some things I think that are important to follow is going to bed at the same time every night, getting up at the same time every morning. Exercise, continue your exercise. I know that there are so many more limitations than we used to have. I have patients that are really confined to their room still, even at this point. But if you can, even if it's in a walker or a wheelchair, getting a set of light weights and doing some exercises, or walking back and forth in your room 20 times. I mean, anything you can do is going to help. I also think if it's possible to exercise in the morning, and even if you're not a morning person, I would recommend this, because what I find is as the day goes on, we all have things that we'd rather be doing and that get in the way. And if you do exercise first, then you have it done, and there's no reason to not do it. Planning activities. So whatever you used to enjoy, for everybody this is different. I just put it kind of a general list, but reading, cooking, music, computer games, talking with friends, gardening, learning a class online, spiritual activities, whatever is something that you enjoy doing, making time for those things and having a set time to do them. Getting outside, and again, even if you're confined to your room, or if you can go out, getting into a courtyard wherever you live, going outside if you are in your own home, taking a walk, even just letting the window open. Now we're finally getting into fall, and having some free time or free days here and there. So I pulled up a couple different articles that I thought were good and were important for seniors. So one is a daily routine. This is from dailycaring.com. And it talks about why a daily routine is important for seniors, 3 benefits. So a lot of what we talked about is people more, I think, in this time than ever are afraid of the unknown and what's going to happen, because a lot of things we really, for all of us, myself included, took for granted are now gone. So, as you lose control over the situation with the pandemic, also losing control over physical abilities and feeling like you're worsening, it's important to set that structure in place. Talks about what a daily routine is, doing the same activities around the same time every day. Allows you to have a natural flow. And then 3 ways that a regular daily routine benefits seniors. So it talks about reducing stress and anxiety, increasing the feeling of safety and security, improving sleep. So all these things, are problems for a lot of people right now. I also found this on the Alzheimer's organization, and there are many, many websites out there to help, but a daily care plan. So organizing the day. So they have, again, thinking about what you want in your plan. So thinking about what you enjoy doing, what you don't like doing, what your interests are, what your abilities are. And it has a checklist of daily activities to consider, many of these things we talked about. Writing a plan, and what you want a daily plan. So it has kind of example plan for people, what you do first thing in the morning, afternoon, evening. There are some websites that actually go through hour by hour what you do. You know, again, it just depends on your personality and what kind of structure works best for you. But I do think having something that you're looking forward to every day and that some sort of schedule, I think is very helpful. Along these same lines, there are multiple opportunities for free exercise. I think probably most of the people watching this video are aware of the different opportunities that are in Austin. I have a link for Power for Parkinson's. As of, I don't remember if it was March or April at this time, everything's starting to run together. But Power for Parkinson's, this is their website. If you are not aware of them, they're a wonderful nonprofit free exercise. This is their class schedule. So they have, 5 days a week. They have multiple different classes going on. They're free. You just join live on YouTube. They also have multiple taped videos as well. So they have on YouTube, they have a channel and they have multiple tape videos if these are not good times for you. So again, that's powerforparkinsons.org. The other group in town started as Rocksteady Boxing, now is 413 Fitness. Same thing, they do have in-person schedule, wonderful group. And they also have a lot of virtual. So again, if you can't get out, these are free virtual classes. So all here, as well as a lot of in-person. The in-person, it is a paid program, so you do have to pay. You also have to sign up. That way they're able to limit the amount of people that are in their class. So again, I'm just showing you, today is Monday, September 7th. So this is an example of their classes and everything that's on. The last group I'm going to mention is the Parkinson's Voice Project. This is a group out of Richardson, Texas. I worked with them a lot when I was in practice in Dallas. And these are free speech exercises. So again, they have Facebook Live Parkinson's free exercises Monday through Friday at 10 a.m., Tuesday at 6 p.m. There's a global virtual choir. The Facebook Live classes, I'm told that you don't have to have an account. You just click on it. And the other thing, let me click on it real quick here. If you have, if you come at a time where, again, it's not convenient for you, Samantha is the founder. And she is right here, and she has these videos up so you can watch them at any time. You can watch older videos as well. So these are all of her classes right here. So this is her Friday class and Monday. There's a couple other programs that I actually found out from other patients. One is called Parkinson's Wellness Recovery. I believe that parts of this you do have to pay for, so that's why I put it on a separate slide. Again, I'm going to click in with this, but PWR, or Parkinson's Wellness Recovery, there's a lot of resources here, a lot about them. They do have some videos as well, YouTube videos. So I think some is free and some may be paid for as well. And the last one I recently learned about from a patient called Daily Dose PD. It was something that he had signed up for, really enjoyed. I think that it is, $29 a month or $290 a year after a 30-day free trial. So you can do a 30-day free trial. These, I would say, are probably more advanced exercises, but they do have free videos, forums, and it's something that you can do every day if the other exercise programs are not anything that you're interested in. So there's a lot out there. There's a lot online that you can be doing. I would say in terms of other help, I encourage everyone really to talk to your doctor, friends, family. If you are feeling down, sad, apathetic, anxious, if you're losing sleep, losing weight, losing your appetite, there are a lot of other ways that we can help you, and a lot of treatments that are available. So medication is one option. There are individual and group counseling, and most insurances will cover this, and most places are doing virtual counseling. So most counselors out there have converted to virtual counseling, so it's not something that you'd even need to leave your home for. There are help for care partners as well. There's some through the Alzheimer's organization, as well as AGE of Central Texas. That's another group that's in town that has help and information for care partners or caregivers. Your physician, either your primary physician, neurologist, can refer you for exercises with PT, OT, speech, and cognitive therapy if you feel comfortable doing that. If you are homebound, you would qualify for this through your insurance. And then there are always alternative as well, alternative therapies, chiropractor, massage, acupuncture, meditation, just whatever you feel most comfortable with. So just some final comments on this. Eventually the pandemic will end, and I think the thing that's been the hardest for all of us going through this is that the timeline keeps shifting. When this first started, I know for myself personally, everything came about over spring break, and I looked at my schedule the following week, and about 80% of my patients were over 70. And I thought, well, given the circumstances, I'm just going to convert to telemedicine. And that's what I did for a week. And I'll go into that a little more, what our practice has done. But it's scary because I thought, well, I'll do that for a week. And then, after about a month or so, we'll just get back to our usual routine. And then a month, things weren't better. As a matter of fact, they seemed like they were getting worse. And then it seemed that we were flattening and then we're peaking. So I think it's an adjustment, and it's really hard when you feel like that carrot keeps getting pulled further and further away from you for the end of this. But eventually it will end. Eventually they will have a vaccine, and life will be different than it was before. This was, I found this article today about vaccine distribution. I haven't seen this before, but I thought it was interesting. This was an article from the USA Today, September 7th. And let me go back and see if I can get that link to work. So this is kind of interesting, and again, I'm not going to go into it a lot, but it talks a lot about how complicated it is going to be to distribute the vaccine once it's approved. So there are, oops, I think I just clicked on something else. Sorry, clicked on an ad on accident. But what it talks about is, how once a vaccine does get approved, it's going to be in short supply. The targets are going to be frontline workers as well as those considered higher risk. And so the CDC, again, is working on that. They're hoping that they're going to have a vaccine available, or at least approved, in the next couple months. And there are two that are the front runners through Pfizer and Moderna. So anyway, I found that this was a pretty interesting article. One thing I did not know is, I guess the vaccines have to be chilled and kept very, very cold, below freezing. So that's going to add some additional nuances to transporting and packaging and that type of thing. So, but anyway, I thought it was a very interesting article. And at this point, some of the newest information, things that I had not heard about. So how our office has changed. So our office is certainly going to be different than a lot of your other doctors' offices. We are 5 neurologists, all with different subspecialty interests. So I'm the movement disorder specialist. We have a multiple sclerosis specialist, a neuromuscular specialist, a sleep and epilepsy, and then a headache specialist. So we are all doing telemedicine in some form or fashion. A couple of the doctors in our office are only seeing new patients in person, and they're doing all of their follow-ups as telemedicine. Some are doing more in-office visits. Mine, for me personally, initially I did 100% telemedicine for just 1 week. I just converted everybody that week after to telemedicine since everything was so unknown. Then from, let's see, I guess starting April, May, I was about 75% telemedicine, 25% in the office. And as of June 1st, it's about 50-50. So just a little bit of background about our clinic, because I know I've been asked this multiple times by my own patients. And again, your neurologist, cardiologist, primary care, we all have different situations. We all have different patient groups and populations that we're working with. But just so you kind of realize some of the background of what is happening in different offices, we personally have an infusion clinic. And as part of our infusion clinic, the bulk of our patients, about 90%, are patients with multiple sclerosis, and they are on immunosuppressive drugs. So they're considered high risk. So in order to keep running, we had to space the chairs out 6 feet apart. Everybody wears masks, and we had to take up about half of the waiting room to spread out those infusion chairs. So that then made our waiting room smaller, and we have, in order to keep people spaced out, we have 8 or less patients in the waiting room at one time. If we have more than that, then we've asked people to wait in their cars, or we've tried to get them back at least into a room where they're away from other people. Everybody who comes in, including infusion, our physical therapy, and our clinic, has their temperature taken, and they have questions regarding COVID. The Texas Medical Association has set out a standard set of questions, and probably any clinic you go to in Texas is going to ask the same thing. So they ask if you've had a fever, if you've had any exposure, if you've had a positive test, if you've had any outside travel. There's 5 or 6 questions that we ask every person coming in. We also have had to increase the amount of cleaning of the rooms in between patients, and everybody's required to wear a mask. For myself personally, even in the common areas in the clinic, we all wear a mask. The only time we take it off is if I go into a room to do a telemedicine visit, then I can take it off then. So again, my schedule is going to be different than many of your other doctors. The way that we have worked this with the 5 of us is in the morning on Mondays, I am in clinic, and in the afternoon, I do telemedicine from home. Tuesday through Friday, that's switched, where in the morning I do telemedicine from home, in the afternoon in the clinic. Again, this helps limit the number of patients in the waiting room, exposure, etc. Follow-up in the clinic. So follow-up patients, we have tried to prioritize deep brain stimulation patients, patients that are receiving botulinum toxin for either dystonia or drooling, and then patients that are enrolled in clinical trials in our office, because those patients have to be seen in person. Obviously, we can't inject anybody remotely through telemedicine. We cannot do DBS adjustments remotely either. If you are a DBS patient, and many of you have done this with me, as long as you have your patient programmer, we can check your battery together over the televisit. I can have you increase, if we have parameters set, we can do that. But if you need new programming or new programs, we just cannot do that remotely. It just doesn't exist. So for that reason, for most patients that are high risk, which is the majority of who I see, we're trying to do primarily telemedicine. For new patients, initially, my plan was to not do any telemedicine, bring everybody in, but logistically that just has not been very practical. We've got patients on the schedule now booked several months out. So if you fall in one of those time slots where you're on a telemedicine time slot based on when I'm in the office, then we start it with telemedicine. What I've done for most people who do feel comfortable coming in is do the new patient visit through telemedicine, and then get you in the office within about a 2-week period for a follow-up appointment where we go through your exam and talk, further about things. But it is a follow-up time slot, which is a lot shorter on my schedule. My new patient visits are about 40 minutes, and my follow-ups are 15 to 20 minutes. And so we have more follow-up visits per day than new patient visits available. So I know some people have been resistant to telemedicine, and that's completely fine if you want to come in as a new patient, but just realize that we've got other patients scheduled right now, and we're trying to get people added on as cancellations come in. Additional changes that we've done to try and get new patient paperwork in is we have a secure email now. We got this about 2 months ago to send in new patient paperwork. We also have a drop box outside of the building to drop off forms that's secure. You can do that 24/7. So if you are worried about interacting with people, you can come at a time where there's nobody around. We've also started doing text confirmations for appointments. So watch for those if you do have a cell phone. And if you do have an appointment scheduled with me, it's still scheduled. It's still the same time. It's still the same day. If it falls on a telemedicine morning or afternoon, it will be a telemedicine appointment. If you feel strongly that you want to come in, that's completely fine. And I understand that we have a lot of patients that are in this situation. We'll work to do the best we can to accommodate you. But I just do want patients to understand what's going on in the background and all the balls that are in the air that we're trying to make sure we're keeping everybody safe, not only for my patients, but for the ones who are in the infusion suite, et cetera. If it falls on a time that I am in the office, you're welcome to come in, or you can convert to a telemedicine at any time. Again, I probably am going to be keeping this schedule, I imagine, through winter, maybe early spring, because we don't know what's going to happen in cold and flu season. And sometimes these things change pretty dramatically week to week. When we hit the peak in Austin, what I found is though, when I was in the office, about 50 and sometimes 80% of the patients would call in that morning or a day before and say, I was planning to come in, but I really don't feel comfortable. Or we've had some patients call in and say, I had an exposure to COVID, so now I need to switch to a telemedicine, or I have COVID and now I need to switch to a telemedicine. So we're very flexible. We're trying to be as accommodating as possible. And, we can do telemedicine from anywhere. So that's how our office is working at this time. So new therapies for 2020, there's a couple medications I wanted to mention because they are both coming soon. Chemmobi is a medication called apomorphine, which has actually been out for a pretty long period of time as an injection. The brand name is Apokyn, and it is for off episodes. This instead is the same drug, but it's put under the tongue. I'm gonna click on the link here. This is their website, so you're welcome to look on that. I've been told, it says that it is available. I have not given it out yet by prescription. I was contacted by the company in order to drop off kits and give us an explanation. My understanding is that if patients want to try it, we can give them a starter kit to try it on their own. We did participate as part of this clinical trial, and we had over 20 patients enrolled that did try this medication. Our experience with it overall was very good. I think for some patients it's very, very helpful. When you are experiencing an off or know that you're going to go off, you place this under your tongue. Depending on the patient, patients would usually kick in between 10 and 30 minutes. Probably more often than not, it was a pretty quick kick in around the 10-minute time frame. For our patients, we did have several patients that discontinued the drug due to taste. So I'll just warn people about that before they go on it. Others, it didn't bother them at all. So I don't know. We're not allowed to try it, so I don't know what it tastes like to me. But this is coming, and it's coming very soon. So if not already available, it's just right around the corner. The other drug that is coming as well is Ongentys. And I'm going to click on the link here. There's a commercially available drug called entacapone, and this is a component in Stalevo, if any of you are on Stalevo. Entacapone is added to carbidopa-levodopa to prevent the breakdown of levodopa. And opicapone, instead of entacapone currently you take with every dose of your carbidopa-levodopa, and opicapone you take one time a day, and it prevents the breakdown all day long with your other doses. So this is something, we were not part of this clinical trial. It will be new for me as well prescribing it. It is indicated in patients with Parkinson's disease who are experiencing off episodes. So again, look for that to come available. Both of these were approved in the spring, April-May timeframe. They both had a delayed rollout, I think because of COVID. So just a final slide about our research. We do have several ongoing clinical trials at Central Texas Neurology Consultants. If you have any interest, you're welcome to call 512-218-1222, and Connie is my research coordinator. Her extension is 214. Sindel is my medical assistant. Her extension is 211. And then I've got a secure email listed here as well. If you are seeing a neurologist, another neurologist, you do not have to transfer care or change care. You're always, we have multiple patients that come in, participate in a trial with us. We communicate with their primary neurologist if they need changes in their medicines, and that is handled by their primary neurologist. And when the trial is over, they go back. So if you are one of my patients, please feel free to reach out. I do, on an ongoing basis, try to screen as we're in follow-up visits together and bring different trials up to patients who may be interested. In addition, other opportunities are through the Michael J. Fox Foundation. We talked about foxinsight.org in the beginning. They do have multiple trials that are just online, and I think anything that you can do to help push forward our knowledge of Parkinson's is just fantastic. So if that's something that appeals to you, that would be great as well. This is a thank you slide to the company who created the background for the template. So these are little coronaviruses. I found this and I'm able to use it as long as I can tell them thank you. It was created by SlidesGo. There are icons by Flat Icon and infographic and images by FreePic. So these are, all the slides are mine and all the information is mine, but this background of the coronavirus, the blue, is theirs. And last, this is my final slide here. I wanted to mention 2 upcoming events. Everything has been converted to virtual. October 3rd, 2020 is going to be the Michael J. Fox virtual 5K, 10K in Austin. I'm going to connect to their page here. Again, if you go to foxtrot.michaeljfox.org, this was originally scheduled in April and we were a sponsor. We're planning to sponsor the virtual one as well. But registration is open. If you have previously registered for it, my understanding is that your registration has continued and you should get your packet. I think that they have a final date to register, which may come after the CAPS meeting, but you may not get a packet, but you can still participate. I think it's $35 or $40 to participate, and basically you do a walk or run on your own time. And last slide to end with is going to be the virtual fundraiser through the Capital Area Parkinson's Society. They always do the fall fundraiser here, and that's going to be Friday, November 6, 2020 from 6 to 7:30 p.m. Again, will be virtual with an online auction raffle, great music and program lineup. And they're going to be sending out a link and keeping people in the loop on that soon. We are a sponsor for that as well. So normally I would take questions at this point, but if you can feel free to reach out if you have any specific questions to the CAPS board members, and they're welcome to get in touch with me. I'm happy to answer anything I can. And let me get out of the slideshow here. Get back on the Zoom. Stop sharing. Okay. All right. Well, I hope everyone has a great day and a great week. And again, please feel free to reach out to CAPS if you have any questions. Thank you.